So now, as I mentioned, let's move to Iwona Hawryluk from Imperial College London. She will tell us about nowcasting COVID using machine learning. Iwona, the floor is yours.
Thank you so much. So hi everyone, and thank you for opportunity to give this talk. So my name is Iwona Hawryluk, and I'm a PhD student at Imperial College London. And today I'll be talking about predicting the present, focusing on the reporting delays in COVID-19 surveillance and what we can do to correct them. So I'd like to start with discussing the importance of the accurate real-time surveillance of the epidemics. So in the past year, we've been hearing on the news every day about the new numbers of infections or deaths due to COVID-19. And this monitoring of the epidemic has been vital because it lets us see whether new interventions are necessary to slow down the spread, or if the numbers of infections are low enough to lift up the lockdowns. The problem is that this real-time data is often not very accurate. And I'll show you an example of that. So can I just ask whether I'm sharing the correct screen?
Okay. Sorry, we see the slides, everything's fine.
Okay, cool. So here on the left, you can see the numbers of deaths due to COVID-19 per day in Brazil. They're shown here with the gray dots. And this data was extracted from the publicly available database on the 23rd of November. So we can use this data to estimate the reproduction number R, which tells you whether the epidemic is increasing if R is over 1, or decreasing if R is below 1. Here on the right, we show the estimated R with 50 and 95% credible intervals. And you can see that R appears likely to be below 1. The numbers of deaths seem to be decreasing, and so the epidemic seems to be under control. But looking at the same time series 3 months later, after multiple updates in the database, it turns out that the daily numbers of deaths, shown here with the pink dots, were much higher and actually were increasing. And if we calculate R again on the right, you can see that R was probably way over 1. So the epidemic was increasing, and perhaps more restrictions should have been implemented at the time. And that shows a common problem in monitoring any epidemics. And the reason for this problem is that the deaths which occur on a given day are often reported with a certain delay. So for example, in many hospitals, especially in the low and middle income countries, the staff collects the patient's records with pen and paper, and then they have to go and update those records online in the databases. And this update often doesn't happen on the same day, and doesn't even happen in the same week as the death, or even in the same month. So that makes it very difficult to know what really is the current death toll of the ongoing epidemic. Here on the left, you can see the daily numbers of deaths in Brazil with different colors showing the different data releases. So for example, here, this green bold line shows that up to day 250, there were around 50 deaths recorded on day 250, and that's according to the release from September. But if you look at the later releases when the data was updated, you can see that almost 1,000 of deaths actually happened on the day. And another way of showing the same data is to construct a matrix like here, in which every row is a day or a week of the epidemic. So here we show weeks. And each column indicates the delay between the death occurring and it being reported online. So here each cell represents the number of deaths, and the darker the cell, the higher was the number of deaths. So for example, here, this cell highlighted in green shows that there were 120 deaths that happened in week 33, but were reported with delay of 7 weeks, so were only reported in week 40. And you can see here that although most cases are reported within 2 weeks since they happen, there is still a lot of deaths that are being reported with substantial delays. And to get the true number of deaths that occurred in a week, you have to sum all cells in that row. But as you can see, almost a half of this matrix is empty because those deaths are yet to be reported in the future. So if you want to know how many deaths occurred last week, you would look at the last row, like I highlighted here, but you only know how many deaths were reported without any delay, with delay equals 0, and you don't know how many will be updated in the coming weeks. So you can see all those empty cells here. So to fix that and ultimately have a more reliable estimate of the numbers of deaths in recent weeks, we can use a process called Nowcasting. So Nowcasting is a method of filling in this missing part of the matrix in order to get a true representation of the current situation. So basically, Nowcasting is like forecasting, but instead of looking into the future, we're focusing on predicting the present and the very recent past. And this process of Nowcasting has been used in the past in epidemiology and other applications such as economics or insurance claims, and is often done through certain statistical modeling. And we created a new Nowcasting model based on machine learning approach called Gaussian processes, which is able to very accurately model this two-dimensional surface presented by the matrix. This method is a Bayesian method, so also it provides us with very useful uncertainty measures of our predictions. And moreover, our Nowcasting model works very well when this two-dimensional surface is highly irregular. And this flexibility to irregularities is very important for the COVID pandemic surveillance, because when the infection levels are low, the hospital staff has more capacity and more time to regularly update the records. But during the epidemic peaks, the hospitals are overwhelmed and the staff is extremely busy, and then the reporting delays are getting longer. And I don't have time to go into the details or the maths behind this model here, but I just wanted to mention that this is not one of the black box algorithms that we heard about earlier today. But in fact, it is quite easy to make sense out of all the parameters that are in this model. So after applying the Nowcasting, we can sum up the numbers of deaths in each row of our matrix, and then we can get the total estimated number of deaths per each week, including uncertainty. So here we can see the numbers of deaths in Brazil as reported by week 60, shown with the blue dots. And the estimated Nowcasted values are shown with the orange ribbon. And the true numbers of deaths that were extracted recently from the update database are shown with this red line. So you can see that the Nowcasted values are much closer to the true values for these last couple of weeks. And our Nowcasting model has been used recently in a study of a new variant of COVID called P1, which wreaked havoc in Manaus, the capital of the Amazon region in Brazil. And this new variant was a result of second waves going through Brazil with much higher numbers of fatalities, and also was a cause of a collapse of the hospital system in Manaus, where basically the whole city started running out of their medications and oxygen tanks. So it was vital that the work on this epidemiological characteristics of the new variant was undertaken immediately. And our Nowcasting model allowed using more accurate real-time numbers of deaths rather than having to wait for the complete updated data. So for example, as you can see in this plot, we were able to estimate the time of emergence of the P1 variant and also estimate the up-to-date reproduction numbers are for both P1 and non-P1 variants. So to sum up, the key points of my talk are: don't trust your data if there can be measurement delay involved. You can use Nowcasting to correct those reporting delays. With Nowcasting, you can get a reliable picture of the ongoing epidemic, and you can measure the dynamics of the epidemic or the effectiveness of restrictions and interventions in real time without having to wait for the data to be updated. And this Nowcasting framework presented here can be applied to other diseases or other applications, for example, actuarial sciences, because it is completely data-driven, so doesn't include any assumption regarding the disease characteristics. So thank you all very much for listening. If you'd like to know more details of how our model works and see some benchmarking against other models and also human experts, you can check out our preprint on arXiv. And if we have time, I'm happy to take questions.
Thank you, Iwona. Yes, we still have some time. I'm actually personally wondering if you used your model to model the outbreak or the second wave in Brazil, or is it also used by local, I don't know, well, government or like medical people working in the pandemic? How is it?
So we did use this model to model the second waves going through Brazil, and that was made in a collaboration with lots of people from UK, Brazil, and other countries. The main problem with Brazil is that there's many research groups working on this pandemic and enrolling there and the new variant, but there is the certain political situation that they have in the country just prevents any like public health interventions. Basically, the president is COVID denier, and it's just very difficult to have any, like, the scientists are getting very frustrated because it's difficult to get real impact.
Yeah, I guess it's not only a case of Brazil, it's more countries, unfortunately. We have another question from Janna Kwiatek. Hi, Iwona. Does Nowcasting requires any special equipment, superpower computer?
No, so it's very easy. So our framework is all written in Python. So that's an open source language. Anyone can run it on their computer. And also alongside our preprint, we released the code on GitHub, so yeah, you can check it out there and adapt to your needs. It basically all it needs is just the mortality data.
Okay, cool. Well, thank you so much, Iwona.